There are several reasons why many of us don't address various health issues. One is you don't know what kind of doctor deals with your problem. And if you have multiple things going on, you don't have the time or energy to go to several locations looking for help. Our next guest can treat a number of things under one roof, from venous disease to uterine fibroids and prostate issues. And because they use the most modern technology, procedures are non-invasive and there's minimal downtime, if any. Joining us with the difference they can make at the Texas Vein and Wellness Institute are Dr. Vasu Rao and Dr. Zagam Bhatti. Also joining us is their patient, Holly Kaiser, who was desperate to get well and feel better. And I'm judging by your smile, you feel better now, right? All right, Dr. Rao, a lot of times vein issues are misdiagnosed or just completely overlooked, and you're not surprised because you remember in medical school, as important as that system is to our body, very little was focused on it.
Yes, I went to Baylor College of Medicine, and truly very little emphasis is put on the venous system. And it wasn't until I got out into the real world of medicine that I saw that there was this huge void in the diagnosis and treatment of vein disease.
Yeah, and one of those voids was because the treatment of it could be pretty aggressive at one time. New technology has changed everything.
Exactly. Back in the day, and that's the memory people have, is what they call the vein stripping procedure. It's as brutal as it sounds, where they actually physically remove these veins in the surgery suite, and the recovery time is for days. Now our new technology allows us to do these procedures in 30 minutes, walk in, walk out, no downtime.
Yeah, all right. Holly, you were experiencing something did you know what it was at first? But give us some of your symptoms that you were experiencing with your legs.
So I've dealt with venous issues since I was a teenager, and so I think part of it's hereditary, and so it's just one of those things you've tried to fix, for several years. But then after 3 kids who were, extremely heavy and kind of wreaked havoc on my body, I just started having a lot more pain and heaviness in my legs, and mixed with the spider veins and all the glorious things that go with it.
Yeah, all the glorious things that go with it. What was your breaking point where you said, okay, I can't deal with this anymore?
I think just feeling gross. Like it felt gross, and I felt like I looked gross, and was embarrassed, honestly.
Yeah, but the heavy legs too, I would imagine. You have 3 boys trying to keep up with kids too.
Yeah, and just being on your feet all the time. I run an interior design business, and so just up and about all the time, and it's just, it wears on your body.
Yeah, literally wearing you down and weighing you down. All right, so this is where it's really important to have the correct diagnosis. So when she came in, what did you see, and what does the diagnosis part entail?
The diagnosis begins with an ultrasound. So we evaluated Holly, did an ultrasound. We try to complete all these in the first visit, so they're not coming back and forth for multiple exams. So when she left that day, we had found her veins to be leaking. The valves were non-functional, mainly from her pregnancies, and so we set her up for treatments where we did radiofrequency ablation on the leaking veins.
Okay, and so how did that go for you?
That was amazing. And like you said, or he said earlier about the vein stripping, I'd had that done. I feel like I've tried it all, and it's horrible. And so with his procedure, it was so quick, and I didn't have to wear the dreaded horrible hose for months on end. He's like, oh no, just
and with that new technology, you literally went in and walked out, right? As opposed to the vein stripping of yesterday.
And you're not in tons of pain, and it just heals up so quickly.
Yeah. All right. So obviously, when you have like some of the issues that you had, you mentioned the hereditary part, which part of it can be hereditary. But when you have that severe of leakage and things, it can happen in other parts of the body. Dr. Bhatti, you all deal with some other issues. When you found out that Holly, you started. This is the importance of sharing information with your doctor. I'm going to say this right, because you all started asking some other questions with possibly suspicion that other things may be going on, and you got what kind of answer?
Well, once we treated her veins, kind of that now allowed her to see other symptomatology, and she felt some pelvic congestion symptoms, which is heaviness and pain, and so we referred her to Dr. Bhatti for that evaluation.
Yeah, and Dr. Bhatti, you all treat in particular a couple of women's health issues.
That's right. We treat a couple of different relatively common conditions that women suffer from.
Yeah. And you say relatively common, and I guarantee you a lot of people will go, what? And others will go, yeah, I'm dealing with it, because we don't talk about it as common as it is.
Absolutely, absolutely. So one of the conditions we treat is something called pelvic congestion syndrome. This is relatively common in women who have chronic pelvic pain. There's actually a prevalence of about of nearly 30% of this disease process in these women. Other symptoms associated with this include pain during and after intercourse, urinary bladder irritability, urgency. Of all gynecologic consultations, approximately 15% are due to chronic pelvic issues, but only about 40% of those cases get referred out to a specialist.
Yeah, so, and then uterine fibroids is another issue a lot of women deal with.
Yes, absolutely. So, with regards to pelvic congestion syndrome, fortunately, many of those women actually undergo pelvic floor surgery, even hysterectomy. Unfortunately, the underlying issues in this disease process are just not picked up on.
Yeah.
So the actual issue here is abnormal veins within the pelvis surrounding the ovaries and the uterus. That's actually what causes pain and some of these symptoms, and it can be quite debilitating for women.
And Holly, it was quite debilitating for you,
Yeah.
and also does a big number on your self-esteem.
Oh, totally. Yeah. And like you said earlier, I think it's important that we talk about it because no woman wants to talk about it. Like, so
Right.
how's your pelvic area doing?
Yeah. How's the land down under doing right now? Yes.
And but through both of their help, they were able to help me realize that there is another issue. I've tried to figure it out, the pain and because a woman knows her body
Right.
and knows that something is not right, and just different things. And so they were able to just pinpoint it and just say, no, you're not crazy, you're not a hypochondriac. This is a real thing, and it's great. I mean, it's literally life-changing.
Yeah,
So.
and once again, just like they did with your veins, that new technology meant you
Yeah.
could just like take care of it
Yeah.
and move on, as opposed to yanking out an entire body part,
Exactly.
right? Okay, y'all do a number of things because of this new technology. So for men dealing with prostate issues, you have a treatment as well.
Right, and Dr. Body will explain a little further, but basically as the prostate enlarged, the options were basically TURP or major invasive procedures. Now we're able to go in with catheters and embolize and help reduce that swelling. in
Yeah.
prostate
So what men should look at coming in for this?
So men who suffer from urinary symptoms, so urinary frequency, urgency, painful urination, the feeling of incomplete bladder emptying, those are all symptoms that men should look for.
Yeah, all right. And then there's something else that this modern technology can do that I find amazing, because we know that we're basically outliving our body parts today, aren't we? So many people are looking at knee replacements, and we know that can be, can be a tough surgery for a lot of people in the recovery time. How are you using this technology to deliver a remedy for that?
So what we've discovered in the past few years is that for patients suffering from osteoarthritis, wear and tear of their knees, it's not actually the cartilage loss, the bone-on-bone disease that results in pain. It's actually the inflammation that's created in the knee. And that inflammation is fed by new blood vessel formation in the knee joint. And so we have a procedure called an embolization procedure. It's similar to what we do for pelvic congestion. It's similar to what we do for women who have uterine fibroids. But we do this embolization procedure. And embolization, by the way, means that we're just shutting down abnormal blood vessels.
Yeah.
So when we go into the knee and we shut down the abnormal arteries that have been created by the body that are feeding the inflammation, patient's pain resolves.
Yeah, all right, because the venous system is like, it's the life's blood basically to
Right.
the entire body, right?
Right.
There's miles of veins and all kinds of areas where things could go wrong.
Right, and by this procedure, you help these patients delay potential knee replacement,
Yeah.
and it relieves their pain almost instantly.
All right, Holly, for somebody out there who has one or all of the issues that we talked about, what do you have to say to them? Because we do have a tendency to put things off.
Yeah, I think what I'm happy with is that we're at a culture now to where women just want to just say, enough is enough, I'm not perfect, it's okay. And to just go seek help. Like, it's worth it, and we're all human, and we all have our own issues, and so
Yeah.
there's nothing to be ashamed of.
You got your
know?
life back.
Yeah, and you get your life back.
All right. Texas Vein and Wellness Institute has a special offer for Great Day viewers. The first 100 patients to give them a call today will receive a free screening. To make an appointment, call this number on your screen. It's 281-888-1464. Again, that's 281-888-1464. You can also visit their website at txvwi.com. And of course, those letters stand for Texas Vein and Wellness Institute. Thank you very much.
Thank you. Thank you, Deborah.